Welcome to Got It From. This is Will Sanchez. Thank you for tuning in. My very special guest today is Dr. Ilana Slaff. She runs for the Queen's Distance Runners. She is a psychiatrist specializing in autism. Recently, she published a very personal book about autism called Don't Medicate, Educate. I'm honored to have Dr. Slaff as a guest. Dr. Slaff, or can I call you Ilana?
You could call me Ilana, that's fine.
Thank you. Ilana, before we go into your book, it's a very personal book. I started reading it a few days ago and I couldn't put it down. So thank you so much for educating the general public about this syndrome, or spectrum they call it. Mm-hmm. It's very interesting. Well, before we go into that, let's introduce you to our audience. Tell us where you were born and something about your growing up years.
I was born in the Bronx, and I grew up in a housing co-op. I went to local public school. My brothers attended initially a public school autism program, but it was a cooperative agreement with Columbia University. And it was actually located in Columbia University. And it was a wonderful program. I remember that the teacher would try to get me involved in the class. My mom wanted me to see what my brother's school was like. So I would go down there and sit there at circle time. And I remember the teacher would try to get me involved in doing things with my brothers. She had books. She made these little books for me to do on the weekends to go with them. Today I did this or that. It was a really nice experience. The only thing I did as a child, though, because I went to a local crowded public school, was I would get jealous and think, wow, they go to this really nice school and it's so, such a small class and all these toys and fun things.
Interesting. They're twin brothers, right?
They're identical twins, yes.
It's so interesting. They're younger than you.
They are 2 years younger than me.
Okay. It's such a sad story that they were autistic. How was that discovered?
My mom suspected something wasn't right, and the pediatrician kept denying it and saying everything is fine. And at 2.5, my mom decided something is wrong. Their language wasn't coming in. They were rocking back and forth on the couch. And she took them to a specialty clinic, and over there she was told that they were disabled. Mm-hmm. And that's when she got them some special help. Initially, when my mom went to take them for special help, my parents were blamed for the problem. The women at the clinic told my parents that she should institutionalize my brothers. My parents didn't listen to that.
Yeah.
And my mom at one point, because while evaluating my brother, she suddenly said, the professional said he's retarded. And my mother was stunned. She was shocked. And then when she took the car to go home, she actually drove the car over a barrier. She wasn't able to think properly after that happened. So it was, it was a difficult time, but they did find help. There was no real special ed school at that time.
That in the 80s? What time
71.
Frame?
They were born in 71, and the first education for all handicap law wasn't passed in this country till 1975.
Okay.
So my mom found a regular nursery school. The first regular nursery school threw them out. Then she found the second one, and the teacher was really nice. She said, just don't send them at the same time. The teacher was also the director, and she said, just send one in the morning and one in the afternoon. So my mom did that, and they went there for a few months. And then later, my mom found the Columbia University program started up as a federally funded pilot program.
Interesting. So you are really a pioneer in many ways in treating autism. And you were just a young girl, so did you realize there was something wrong with your brothers?
I used to wonder when they were going to talk. I kept thinking, I talked when I was 4 years old, so they should be talking when they're 4 years old. And
right.
I was wondering, when are they going to talk? I remember that. And they did develop language, but it was never completely fluent.
Okay. Why did the teacher advise one going in the morning and the other going in the afternoon?
It would have been very hard with their behaviors for the teacher to handle both at the same time. My brothers could be disruptive. They didn't necessarily follow rules. They had autism. They weren't always participating. One of my brothers used to keep rocking under the easel in the nursery school. Mm-hmm. And my brothers, even when very young, had behaviors. My grandfather had to pad the cribs because they were banging their heads.
Well, you're a doctor now, so did that sort of help you decide your future career?
Definitely. That's why I became an autism specialist. I didn't even want to continue with general psychiatry. I did general psychiatry for a while, and I just figured other psychiatrists can do what I'm doing.
Okay.
You know, and I felt by specializing in autism, I could offer something that most of my colleagues couldn't offer.
Yes, especially you having personal connection. Okay, so which college did you go to?
I graduated Hunter, and I went to SUNY Brooklyn, which is now Downstate Medical School. I did my residency training at New York Medical College, and then I did my fellowship at Mount Sinai Hospital in autism research.
Okay, that's a lot of schooling. During that time, what was your physical activity? How did you maintain your endurance, your physical wellness?
I was never into physical activity very much because I had very negative experiences when I went to public school as a child. I don't have the best gross motor skills, and I had trouble even throwing a ball, and I would get bullied, or if the teacher had two students choose teams, I'd be the last one sitting there. So, of course, that was very bad on my self-esteem. And eventually, my mom got a note from the doctor that I had asthma, so I was able to get out of gym class, and I had absolutely no interest in physical activity when I was younger. And if you told me when I was younger that one day I'd be running a marathon, I would have said you're delusional. But that changed. When I was much older, actually, is when that changed. And I found out I was pre-diabetic, and I was 131 pounds. For me, 132 would be overweight.
And how tall are you?
I'm 5'1", and it wasn't a good weight for my blood sugar. And so I decided I had to do something, and I was upset. And it was the day after Thanksgiving when I was 131, and then my husband went out and he bought an elliptical, and on a Black Friday deal, and then I started using it. I remember the first time, after 10 minutes, I had to get off it. My muscles were all messed up, and I just couldn't do it anymore. And I kept that up about a year or so, and then one day it broke. And, you know, I realize in life, sometimes when something seems bad at the time, it actually turns out to be a good thing. So I felt I still had the exercise. So then at my husband's urging, I went out and started running. And I realized I could run 8-minute miles. I could.
Wait, off the bat, you did 8 minute
Not off
miles?
the bat, no. First I had to stop like every block. And then I had to brief. I had to alternate walking and running. I was a mess. I was all sore in the beginning. But, you know, within a year, I was of being persistent with it, I was able to run 8-minute miles.
Wow, that's great. How did you meet your husband? Was there a story to that?
I actually put an ad in the Jewish Single News, and he was the first one to respond. So that's how we met. This was way before online. This was back in 1994.
Oh, so interesting. I've been Facebook, your husband's name is Albert, and I could tell he's your biggest fan. He, rather than post about himself, he's always posting about you. Was he running with Queen Distance at that time?
No, he started running before me, and then actually he became diabetic, and that's what started him to exercise. He started biking and running after he was diagnosed with diabetes.
Okay.
It actually happened about the same time my daughter was diagnosed with her autism, so
Oh,
there's a lot going on, yeah.
All right, you've got a lot of life in your young years. When did Queen's Distance Runners, because you both show off proudly the gold, so when did you guys become members?
My husband did first, and then he got me involved a few years ago. I've been doing the 5-milers with them, and I really love it. I've done their trainings in Astoria Park at 6 o'clock in the morning on Tuesdays and Fridays, and it's gotten me real motivation to do speed running and interval training. It's been really a great experience, and they're such lovely people. I love running with them.
So at this time, you're a full-blown MD. You finished your fellowship in autism. What was your first job after getting your medical degree?
I worked in an ER only like once or twice a week at times, just because I wanted to be home with my kids when they were babies. And then what happened was I went to an autism conference. They said that they had an opening for a fellowship program in autism. This was a good opportunity for me to get that fellowship, and I did it at the time, even though I really wanted to wait till my kids were a little bit older to do more hours. I did it a year and a half, and I had the option to do it another year to continue, because I love doing research. But what happened was my daughter with autism, I had to pay her therapy expenses and her school expenses, and it was just too much, and I really couldn't afford to stay in research. I really had to do clinical to pay all those expenses.
Okay. This is so sad. So you have one daughter, looked like they're 2 years apart. So the first daughter was normal
Yes.
in every sense, and then the second one. How did you discover? I guess you already knew this to look for it,
I
right?
knew to look for it. I was suspicious. I mean, people in the family initially were reassuring me, but it just, even the pediatrician was reassuring me, and I was like, I better get her evaluated. Her language wasn't coming in, and it was at the 15-month-old checkup, I remember, and the pediatrician told me I could wait 6 months. I said, I don't want to wait. I decided I'm getting her evaluated, and the psychologist came and told me she was on the spectrum.
On the spectrum. So that's an interesting word. So that's ASD, I think
Autism spectrum disorder.
disorder.
Yeah.
That's the technical term for it.
Yeah, because
Yeah.
it's a whole big spectrum. You have people, that are very low functioning, and then you have people who are geniuses with autism, but socially they run into problems. Their social communication skills aren't there, or they're getting obsessed with things. But they're still, they could be brilliant people and do great things in their lives and make a real contribution.
Okay. I guess one of the questions that came to my mind, you got twin brothers that are autistic and your daughter. Is that genetically inclined? Is that run in families?
Yeah, it does run in my family. I have a lot of cousins with autism.
Oh my
and
gosh.
it was always a fear of mine. And in fact, before I had kids, I had a genetic workup done, me and my husband, and they told me there was only a 3% chance that my child would have autism. And also, I was initially reassured because when I was pregnant, I found out she was a girl, and all the people with autism in my family before were boys. So I said, oh, okay, it's a girl, it won't happen. And
So you were the first to have a girl that was, oh my gosh.
First one in the family.
Do vaccines cause autism?
Vaccines do not cause autism. That's been well studied. You got to remember, everything you do in life, there's a risk. When you get into a car, there's a risk you're going to get into an accident. Right? And, anything could possibly have a risk, but the risk of not getting vaccinated is so much greater than any risk of getting a vaccine. We're not seeing in this country anymore people walking around without limbs because they got polio. We're not seeing it. When polio vaccine first came out in this country, people were lined up to get that vaccine. These illnesses are very serious. I've seen patients who came from countries where they didn't have rubella. They got congenital rubella because they didn't have the rubella vaccine, and they were deaf, blind, and had profound intellectual disabilities, not verbal at all. So the risk of not getting that vaccine is so serious.
The science is there, although there was news that Robert Kennedy Jr. is anti-vaccine.
Yes.
I'm not quite sure where he stands.
What I will say is that a lot of times what you'll find is that the same people that are saying that not to give vaccines, they're advocating for mega doses of vitamins or minerals that could be very unsafe.
In lieu of vaccines?
Not in lieu of vaccines, but as a treatment for autism that are not well tested and can be very unsafe. For example, very high doses of vitamin B6 can cause nerve damage. Some people are advocating for chelation therapy, which is very dangerous and can kill and has killed. So you have to really look at the science behind things. And as you know from the title of my book says, don't medicate, educate. So I don't believe we should be giving out medications or any chemicals unless the scientific evidence shows that that's what's indicated and that's what's going to help and that we have a better benefit than a risk.
I started reading your book a few days ago. It's extremely well written and very easy to read too, and it's very personal. And one of the, talking about science, one of the things you talk about is aversive therapy, which is studied and has
119 peer-reviewed articles.
But yet, it sounds like you're an army of one in trying to maintain that therapy, because one of your brothers had it, and it was life-saving for him. And I think he's in Massachusetts, and your other brother, wholly different events for him. He's in New York, and it's quite different. So, tell us, what is aversive therapy, and why are people against it?
What aversive therapy does is is basically a procedure that you do to it's an uncomfortable procedure that decreases the frequency of the behavior occurring again. So positive reinforcement is when, let's say, somebody does their work and then you give them some music or you give them a toy or you might give them a piece of food, and then they're more likely to engage in that behavior again, or even verbal praise for a lot of people. So an aversive is a procedure where, well, for my brother, it's a 2-second skin shock. He hasn't even had one in over 4 years. I went in Massachusetts, although he's had to wear the device at times, and what that did was it stopped him from his head banging, because he needed surgery to close his head years ago. And he was in the hospital over 5 months, and the school in Massachusetts, the Judge Rodenberg Center, was the only school in the country that would accept him. He was in the hospital with heavily medicated, very sedated. He had symptoms even before he went to the hospital of neuroleptic malignant syndrome, which could be deadly. Sometimes we didn't even realize how severe it was. We didn't take him to the hospital. That happened on Haldol, which we took him off right away. The psychiatrist just said to take him off. And that what happens is the muscles break down, and it could be deadly. And you know, a lot of people with autism can't communicate their side effects. If they're getting symptoms in the middle of the night, we won't know that they're getting those symptoms.
Because they can't communicate,
right.
Or, okay.
They're not going to call you for help and say, I'm not feeling well, and you get things too late. And he also became obese. He was drooling all the time, and he lost his ability to communicate because of the medications. And that was really sad also, because, you know, improved communication also can help with behavior.
Right.
We didn't want to see him going backwards, morbidly obese, a mess, and just sleeping 16 hours a day. And in this school, they took him off all his medications.
Rodenberg Center?
Judge Rodenberg Center, yeah.
Okay.
He's on 6 positive behavior plans. He earns reinforcers all day long for engaging in positive behaviors. He now actually has a job at the school. He's working, he's earning money, he sweeps the floors. It's amazing, and he loves it. He's in a more independent house now, and they take him shopping. He picks out his own food.
But yet, the Rodenberg Center is attacked all the time.
I know, and I think that's so unfortunate. It gets attacked, and yet for a lot of people, the alternative is just being in the hospital. In fact, people have left Rodenberg and been in the hospital for years with no place to take them. You have to look at what the alternative is. You know, we now have 70% of people with autism, age 8 and up, are on psychotropic medications. And every year, millions of people go to the hospital from from side effects. Thousands of people die. And it's awful that we're just giving these kids medications and adults rather than giving them decent behavior, effective behavior plans. And a lot of times, you know, the parents don't know, the schools push it on the children, the day programs, the residences, they're just pushing it on the adults. And they're getting toxic side effects. They're dying much earlier than they should be. You have to look at the alternative. If the alternative is to take drugs that can give you heart disease and diabetes and break your bones down and give you liver problems and all that, and you say, okay, a 2-second skin shock, who would refuse it?
In fact, you tried it yourself, that the skin...
That's right.
To 2 seconds, sometimes it might last a little longer, but just a very short pain.
One of the impairments that people with autism can have is sensory impairment. It's actually in the current criteria from the Diagnostic and Statistics Manual. And what happens is they don't feel pain the same way other people feel pain sometimes. And so normally we don't bang our heads or go out in the middle of the winter with just the bathing suit on. It's going to hurt. And the reason we feel pain is to keep us safe. But their pain system isn't working naturally. So it's basically giving it to my brother in a different way, because his natural pain system. Right. Because when he bangs his head, it's not hurting him. He'll do it again and again. It's actually giving him some positive reinforcement. Because he gets attention. The wrong kind of attention. Not necessarily even attention, because he's like even, he has in the past also scratched his fingers to bleeding, and he'll look when nobody's watching, and that's when he'll do it, because for him, for other people, it would hurt us. For him, it's actually feeling good. Really? Yes. Oh gosh. So what is the alternative to aversive therapy? More drugs? That's what it is, because if you look at the research on just using positive therapy alone, you can only suppress behavior 90% to the frequency of a behavior 90% in only half your subjects. The other half, you cannot get that suppression. And when you talk about a life-threatening behavior, you need to get that suppression close to 100%. Absolutely.
Okay, all right. So I'm also reading the drugs have side effects, so they're taking other drugs to offset the side effects. It becomes a never-ending, and it looks like the pharmaceutical companies just makes a ton of money doing this.
I believe they are part of the problem. The pharmaceutical industry, this was in 2010, the estimate was $2.2 to $3.5 billion a year they make off medicating this population. My brother Stuart, who could not get access to the Aversive treatment, he was recently lowered from 20 to 19 medications, and most are psychiatric or to treat the side effects, and he is sleeping late in the afternoon. He has no life, and he's also had seizures from these medications, which people with autism are more prone to. They're more prone to side effects from the medications.
Yeah.
But what's happening is these groups, when I've researched them, I've noticed some of these groups, which I talk about in the book, that are against the Aversive treatment have been getting money from either the pharmaceutical companies or the retailers.
Okay, it's a corrupt system. I hate to use the word corrupt because it's overused in our political climate. Fake news also. So the two brothers have very different lives. One's in Massachusetts at a school that gets attacked all the time, and the other's in New York. And New York, is well known for being very generous in terms of supporting the elderly, the disabled, but they haven't had to act together in terms of applying the right kind of treatment, the education, speech therapy, and if something happens at 21.
After 21, the Individuals with Disabilities Education Improvement Act doesn't apply anymore, and we really do need some legislation passed, because what's happening is these people often don't get served. I have patients just sitting home with elderly parents that are scared from their behaviors, and they don't know what to do. No program wants them, and they have no rights. I've had parents who had to quit their jobs, families who had to go on welfare who wanted to go to work because they're stuck taking care of these people that nobody else wants.
Do we have any idea why more of it is being reported?
One thing is that we're reporting it much better than years ago. Years ago, people were not getting diagnosed. Even in girls today, it's a problem because usually we think of obsessions and autism as things like trains, but a lot of girls will have actually age-appropriate obsessions. But they may have, let's say, 100 pieces of makeup or something like that, or obsessed with some show that we would consider age appropriate. So we're not picking up a lot of the girls now.
Okay.
And the other thing also with it is that there's other things in the environment, like air pollution is actually a risk factor for autism. So there are environmental contributors.
So if you live in the Bronx, you're in a lot of trouble, or the highway. So is there any good news here?
The good news is that we have to fight to get our children applied behavior analysis, that there is treatment available, and that we need to do things in the system so that it's more available to other people. One of the suggestions I make in the book is that just like all criminals have lawyers, children with disabilities should have the right to a lawyer. This would force the public school systems to fix up so that they're getting effective treatment to all the children who need it. Give the school districts all have their lawyers. Why shouldn't the parents have their lawyers?
Oh my gosh, they can, but it'd be out of pocket. Now, Medicaid
it's out of
is
pocket.
not going to cover it. Yeah.
No, they don't cover, and that and also that's another thing. They need to be covering applied behavior analysis. The school districts need to be covering this for kids. A lot of parents, I find, don't even know what it is, and their kids come into me much older, and and they say to me, "Wow, I wish I knew about applied behavior analysis years ago."
Of course.
And yeah, they don't know how to do basic skills that they should have learned.
Your work involves working with people with autism and dealing with their families. That has to be terribly depressing. I mean, you're very knowledgeable, and I'm sure they're thrilled to have you as their doctor because you can relate to them and give them good advice. But how do you feel at the end of the day?
A lot of times I actually feel in a way, I feel how fortunate I am because I realize I have the funds together, I have the support, and I have the education to get my daughter what she needs and how well my brother in Massachusetts is doing. And I realize I have a lot that my patients don't have because I'm working in a Medicaid clinic in the Bronx with mostly poor patients.
But you heartbroken when you go home,
Sometimes, yeah. I've had days I feel really sad. I've cried in my car on the way home. It's happened.
Well, don't do like your mom and crash into whatever she crashed into.
I'm still been able to drive the cars. But yeah, I mean, there are times I get very sad. But I also find it therapeutic in a way because it makes me realize how much I do have.
Sounds like your daughter's doing wonderfully well. And how old is she now?
She's 14.
Wow. And I think I saw a picture. She's tall like her dad.
Yes, she is, and she's doing great. She's learned how to brush her teeth almost independently now. We did a task analysis where we broke the steps down to 23 steps.
To brush your teeth?
To brush the teeth.
23
steps to brush teeth. A whole paper with task analysis on it, and and what you do is you work on one step at a time, and until she gets it mastered. And we do that. We have a task analysis also for showering, and this is what they need to be doing in public schools with kids,
Oh
so that
my
they
God!
learn.
I'm sure when she sees the dentist that her teeth are the best looking teeth in the system because he knows how to do it properly.
Yes, the dentist is very impressed with her oral hygiene. I could tell you that.
Okay, great. So she knows how to shower herself, go to the bathroom herself, because that's all important to be semi-independent.
She's not totally independent, but she's working on it. She's going to get there. I know she's going to get there.
With you helping her, that's great. You're a runner. You with Queen Distance Runners, the premier running club of Queens. What running event are coming up that you're looking forward to?
I am actually doing the Queens Marathon this Sunday, and I've been training, so I hope I'm fast enough. My goal is to do a 3:55 so I could qualify for Boston.
Oh, you got to do 350. You got to be BQ5.
I don't know if I can do it. I'm going to try my best. That's all I can do.
Obviously, you love your work as a doctor. You're going to continue doing that.
I just started private practice, but generally I'm working at YAI. It's an outpatient clinic where we serve people with developmental disabilities, and we accept Medicaid. I was just speaking to a hospital child psychiatrist a few days ago. She did not know what applied behavior analysis, ABA, was. She did not know. And I think that's really sad, because then when people come in with developmental disabilities, autism, she doesn't know how to steer them in the right direction.
Oh my gosh, so there's a lot of challenges, both in the medical profession and besides everything else with the right protocols and the doing the training, the communications training. Well, I guess aversive therapy is not available in New York. It's available only in this one place in Massachusetts?
Unfortunately, because it's so hard legally, there's so many obstacles to getting it. So that's why you have to go to Massachusetts. There are other schools that do use it actually in the United States. They're not the only school that does, but I don't even want to mention the names of those schools on the camera because I worry about them and about the kids.
They'll be attacked.
Yeah, I'm worried about it.
Because there's bullying on the internet all the time.
I don't want to mention the names of those others. Rothenburg.
I guess they know how to defend themselves because they've been at it a long time. I'm sure they get attacked all the time.
They do get attacked all the time. And I got to tell you, one school already told me not to mention in my book that they use aversives because they were worried they would be attacked.
There is some good news, but not enough of it.
There are people who do need psychiatric medications who do benefit from them, but we're over-medicating and doing it in place of giving them a good education with applied behavior analysis.
This over-medication occurs almost everywhere, including in nursing homes. Although we just touched upon it, but in your book, you notice that they have laws protecting, luckily, our elderly.
That's correct. Nursing homes are subjected to unannounced inspections. The amount of psychiatric medications are regulated by the federal government with these inspections, whereas in the developmental disabilities population, we don't have those protections.
Oh my gosh. Thank you very much for the work you do. It is very much appreciated, I'm sure, by your patients and by the general public. Thank you so much.
Thank you.